Dr. Werschler, thank you for joining us today. You are well known as one of the earliest Piccolo Premium user and as the physician who first proposed the concept of Pico sculpting. We are very pleased to speak with you about your clinical experience and your perspective on how this technology is evolving. So to start, again, to use Piccolo Premium and to introduce Pico sculpting, what is your overall impression of Sculpio platform from both a clinical and technological perspective?
Oh, sure, of course. And first, let me start by thanking you, Dr. Koh, and Laser Optech for being here and having had the opportunity to tour your beautiful office. And it is very exciting, isn't it, to be doing laser just when they think that the best new model has come out, another new, better model comes out. And so yes, the concept, I think, to answer your question, when we think of Pico lasers, and as when we met before at Derma a couple of years ago, and we called that Pico 2.0. Because when the Picos first came out, everybody thought of them as basically a tattoo removing laser. And then it was, well, maybe in some fine lines and superficial scars. And then as technology has evolved, and as we saw the potential benefit for actually tightening, lifting, toning, sculpting, there's so many words that you can use that kind of describe the same thing. I like the laser toning and sculpting. I think that is something that you're not resurfacing. It's a true laser energy. And it gives you the opportunity to have your patients develop rejuvenation and enhancement with almost no downtime. And I always hate to say that there's no downtime, but minimal downtime. And so from that standpoint, it's very exciting to see sort of the fruits of our labor, as we say, over the past 5 years, working with the Pico Low and helping to develop, and I give full credit to my wife Pam as well, and helping to develop the protocols for a more pure toning and sculpting rather than pigment removal and fine lines and things like that. So yeah, it's very exciting, very exciting.
And building on that, Sculpio now includes a dedicated Pico sculpting mode or a PS mode, as you see. From your experience, how do you evaluate this mode compared to conventional Pico laser settings?
Well, I think one of the first things with a Pico sculpting in Sculpio is that we have the level 1 at the deepest and level 2. But not the level 3, the most superficial, which of course with the Pico Low, we have that. And so I think what we're moving into a time when we can pick and choose between the lasers to meet the individual needs. And it's that I'm hoping, and because we don't have the Sculpio yet in the United States, we're waiting on the FDA approval. But I'm hoping that we'll find that it does everything that the Pico Low does in terms of laser toning and sculpting and more, faster, and just sort of simpler, easier.
Since we were talking about clinical experience, as you said, in 2023 at the Derma interview with Medical Aesthetic, you shared your early observations on Pico sculpting. Since then, what have you observed in long-term follow-up, and have your treatment protocols evolved over time?
Well, they have evolved because we didn't really have treatment protocols when we first started, because we didn't know how long it was going to last, what we're doing. What we're finding mostly today is that patients come in and they have 2 initial treatments. 3, 4, 5, 6 weeks apart, but fairly close together. And then we're doing like 1 a year and that seems to not only maintain the effect, but also to continue to enhance the effect.
Yeah.
So absolutely.
So how long is the interval between first 2 treatments?
Well, it depends on how aggressive of a treatment that we do, and it depends on the patient timeline. But I would say 4 to 6 weeks,
4 to 6 weeks.
is common. Well, sometimes we'll push it to 3 weeks. It depends, if people are traveling, they have time off from work, or they're in a hurry because they're getting married or having a graduation or something. But typically it's 4 to 6 weeks, and that works out well.
Yeah.
And then, as I said, going forward, what we have, and I'll show some pictures of this in the presentation, that we are doing more of the once a year or so.
Yeah.
And it's patients now are coming in and saying, I need another PICO treatment. And we're here to do it for you. Yes.
Looking ahead, the Laser Optics Expert Academic Dialogue, which is a lead symposium, is coming on January 17th, tomorrow.
Tomorrow.
Yeah, so what are you most looking forward to at this meeting, and what do you think will be most meaningful for the clinicians attending?
Well, what I'm looking most forward to is to learn from my Korean colleagues who have more experience with the Sculpio, to find out how you're using it, what you've learned in its relatively brief introduction.
Yes.
And what I hope to share is how we developed the protocols to get to the point where the Sculpio laser was developed from the Pico Low premium platform. And it's another generation of lasers, and showing you what you can do with Pico.
Yeah. Expanding the discussion a bit, when you compare Pico sculpting with other energy-based modalities like monopolar, RF, or HIFU devices, where do you feel Pico sculpting truly differentiates itself in clinical practice?
Well, and that's a great question, Dr. Go, because we do RF stamping, and we do the high intensity focused ultrasound. We have the Ulthera, as you know, in the States, and there will be other models coming. So with those three platforms, in our experience, I don't think RF stamping is a nice treatment. I don't think it does the same thing that the HIFU does, or that the Pico Low does. So I put that kind of in a different category. And I think one of the real advantages of Pico Low is it doesn't hurt as much. And that's always been an issue with HIFU. And we've done a lot of things to try to improve that over the years. And it's, I think the consistency of results with Pico is better. And then with RF stamping or RF microneedling, and we use those terms interchangeably, as I'm sure you do here in Korea as well, it can take a lot more treatments. With RF microneedling, when you walk out, you're kind of bloody. And so it's not my favorite treatment. I think it has a seat at the table. I think it's a good treatment, but it's not my favorite. And then with HIFU, it's always really kind of an issue with pain control, which then slows you down. And there's things you can do. So really, I think the toning and the sculpting of Pico Low, it fits better for most patients most of the time, because they want it to be fast, predictable, and it can't hurt too much.
Yes. As a summary, less painful and much more consistent and fast.
Fast, and you nailed it right there. Fast, consistent, and less painful.
Sounds great. So from a broader market perspective, so how do you see the future of this Sculpture Pico sculpting in the US?
I could talk about that for a long time. And on the flight over here to Korea, we had a long talk about how The market is evolving in the States.
Yeah.
And of course, as you know, what we call K-derm and K-skin, those are like the hottest things in the States. And that's why I'm so excited to be here and to learn from you. When I was telling patients that I was going to Korea to do some lectures, like, oh my God, bring me home K-skin products. And I said, well, I don't have that big of a suitcase. But I mean, it's really, you have exploded. And I would say that my perspective in the States is that the newest, most evolved, leading edge skincare products are all coming from Korea. And that's such a neat thing. And in the States, the market, it has changed. There are so many now medical spas that are doing the laser treatment. They are growing much faster than the number of dermatologists or plastic surgeons. So the market is evolving more towards the nurse-directed medical spa. And then within that environment, they want things that are, as we were just talking about, predictable and fast and don't hurt too much. And so I think that the big growth market for all of these devices generally is in the nurse-run medical spa type of world, not necessarily in more physician offices, because I think there's a limit to how many dermatologists. We have about 12,000 dermatologists in the States, and it hasn't changed very much in years. But the number of nurse-run medical spas, I have trivia for you. You will like this. There are now, and this is as of last month, there are more medical spas in the States than there are McDonald's restaurants. And I mean, that, to me, that's shocking. It's like there's something like 13,000 McDonald's restaurants in the States, and there's 13,000 plus medical spas. And 5 years ago, it was probably not even a quarter of that number. So the growth is like this in the medical spas, and I think the Sculpio, that can fit very nicely in the medical spa environment. So that's where I see the market kind of changing now. And yes.
Some pros and cons.
well, right. Oh, that's a whole other discussion. But that's the reality of it. Is that you can open up a medical spa just kind of overnight and find nurses that want to do it. And you know, we know how long it takes to become all the training to become a dermatologist, and even more to become a plastic surgeon. But you know, oftentimes in technology of any kind, not just medical, but of any kind, technology starts off when it's new. It's very expensive, and it's limited to a small group of people. And then as it gets developed, the price comes down. It has more utility. You can do more things with it, and it becomes available to a wider and wider audience if it's successful. And obviously, Pico's been very successful.
Finally, you visited Korea about 2 years ago, and since then, how would you describe the change in Korean influence? You already briefly mentioned on global asset in medicine landscape.
And yes, and it was an honor to be here for Korea Derma, and I thought that was a great meeting. And what I have seen in the last couple of years is that we call it K-skin, K-derm, K-beauty. There's a lot of different terms that are used, and I'm not sure that they're that well defined, but it doesn't matter. As soon as you put the K in front of anything aesthetic, all of a sudden, well, that's the best stuff. I hear this all the time. I hear it from patients. I hear it from colleagues when I travel and lecture. Wow, all the great new stuff is coming out of Korea. And so, I mean, you are having a huge influence on the technology-driven skincare market, whether it be devices or injectables or skincare, and the Korean ideals of beauty.
Yes.
It is the number one topic that we talk about. My nurses at work,
Yeah.
they're all excited to hear about what's new with K Beauty, and that. So congratulations to you. It's taken a long time, and a lot of hard work for you to get there.
Well, even me are a little bit flattered. Dr. Werschler, thank you for sharing your insights and clinical experience with us today. And your perspective offers meaningful guidance for physicians considering sculpture pico sculpting. So we look forward to continue these conversations tomorrow at the LEAD symposium and also in future discussions.
Oh,
thank you very much.
And thank you, Dr. Go. I appreciate once again, it's very nice to see you again. And it's nice to be here. I'm excited.
Yeah. Let's continue tomorrow.